The Youth Crisis Stabilization Facility, also known as the YCSF, is a short-term facility used for youth that have mental health needs that don't require hospitalization, but also need that extra support.
The Youth Crisis Stabilization Facility is a less restrictive option than our youth hospital. It allows kiddos to come in voluntarily. They can leave voluntarily as well.
The kids that we see that come in with a variety of mental health needs. There's a lot of different unique challenges that come with school, technology, and everything that goes on in this day and age.
They can self-refer, their guardians can refer, parents can refer, schools can refer.
One of the things that's really important is our partnership with social services, county organizations, and also with the school system.
YCFS is a great partner. Some of our students have scheduled time there. Some of our students will use it as a crisis assessment to be able to make sure that they are safe during the day. YCFS has been wonderful in collaboration with us, that our teachers and our school staff have been able to still visit students or collaborate with them.
If a professional such as a comprehensive community services or CCS worker, a therapist, a school counselor might be aware that there are some concerns with the youth or that their mental health might need a little bit more support. What they can do is they can work with the families and the caregivers to figure out what is needed for the child. If a planned stay might be beneficial, they can make those recommendations, and then those family members or caregivers can contact our care coordinator.
The youth that are served by social services often have a variety of complex and dynamic needs. When a youth is in crisis, the family unit is typically in crisis because that family unit is trying to support that youth. And so having a place where you can drop your youth off and know that they're going to be safe, know that they are going to get services, know that they are going to leave with different skills than they came in with, and that those skills that they learned will be talked about and transitioned to you as that caregiver so that you can use them, is hugely beneficial.
The atmosphere at our YCSF is a little bit different than what people might typically think of. When they come into our facility, there are private bedrooms, there's an open common space, there's a kitchen area, and there's staff that are able to monitor 24/7.
The YCSF is located on the North Central Healthcare campus. We are located right on Lake Wausau. We have very beautiful walking paths on campus that the youth can utilize. We do have an outdoor space that they're allowed to use as well.
It's a less restrictive setting, so it doesn't feel as cold or as clinical.
A typical length of stay is 3 to 5 days. Each situation is very unique though.
They'll wake up, they'll do their self-care activities in the morning, and then they start with a reflection and goals group. So they'll kind of set their purpose for the day. Then the behavioral health professionals will have groups throughout the day that might include interpersonal effectiveness training, movement, and how physical health impacts mental health. There's also time for arts and crafts.
They have time to work on homework, schoolwork, and then towards the end of the day, again, kind of doing some more groups, winding down.
What we've typically seen with our youth is that they have had hospitalizations in the past through a variety of different settings. And when they've utilized this YCSF, they've actually decreased hospitalizations over the length of time.
The main focus of the YCSF is to decrease hospitalizations, and if we can be proactive in preventing those crises, we can then prevent hospitalizations.
We've seen a change, in students' behaviors and their ability in the school, right, to be able to maintain and be able to regulate emotion, which then helps them to academically succeed as well.
Just having it here and the uniqueness of it is a positive impact on the community culture, that we have something that is really forward thinking.
We accept all insurances. If there's some things that insurance does not cover, we offer the ability to pay. Family, guardian can fill that out with a staff here at North Central, and that will base their rate off of income. Knowing that these services are available in the community is invaluable. We're here when you need us.